Hello everyone, in this video we will talk about Candidiasis. Now Candidiasis is an opportunistic infection, meaning that it will affect people who have a compromised or a reduced immune system. So these organisms will find people who have a reduced immune system due to any reason, and they will cause infections in them. So the infection involves the skin, the mucosa and the internal organs of the person. Now, in the causative organisms, we could have Candida albicans, or we could have a non-albicans group of Candida, which are as follows: Candida dubliniensis, Candida glabrata, Candida krusei, and Candida auris. So these are the causative species which cause candidiasis: albicans, dubliniensis, glabrata, krusei, and auris. Risk factor is diabetes or any immunocompromised state like cancer, or if the patient is taking steroids. So that is a risk factor. Like I mentioned earlier, this is an opportunistic infection, which means that the fungus will find people who are a compromised immune system and it will infect them mostly. But that doesn't mean that it doesn't happen in healthy individuals. It can happen, but it more commonly occurs in immunocompromised people. Now, how do we describe the organism? This organism has ovoid or spherical buds with pseudohyphae. So, something like a hyphae is seen, but it is not a true hyphae, it's a pseudohyphae. And the most common form is buds or yeast form. We know that every fungus has a yeast form and a hyphae form. In Candida, the yeast form is more common, and what you see is hyphae is actually pseudohyphae. Now let us look at the clinical features. So in the clinical features, as we know, the fungus affects the skin, mucosa and internal organs. So let us look at the cutaneous or the skin lesions first. In the cutaneous lesions, we could have intertriginous lesions, which means that the fungus will affect parts wherever there are skin folds. Okay, so there will be a part where there are skin folds, and in between those folds you get sweating, okay, sweat or perspiration, and the skin gets entirely macerated by that sweat. So Candida will affect that part of the skin. Now this could be either in the groin, perineum, axilla or inframammary. So we know that in these parts there's a lot of sweating and the skin sort of folds on itself in these areas. So that is where the fungus tends to cause an infection, and the characteristic lesion in this case will be an erythematous scaling lesion with sharp demarcated borders. So there will be redness, there will be scaling, and the borders will be sharply demarcated. This is the first cutaneous manifestation which occurs between the skin folds. The second cutaneous manifestation is paronychia or onychomycosis, which is an infection of the nails or the nail beds. So Candida can affect the nails and the nail beds as well. Now the second group of manifestations are mucosal manifestations. In this, the fungus infects the mucosal surfaces of the organs. In that, we could have vaginitis, in which the female will have a curdy discharge, and it is commonly seen in pregnancy. So there will be a curdy white discharge coming from the vagina, and intense pruritus will also be there, or intense itching will also be there. The second mucosal lesion is oral thrush. In oral thrush, you have creamy white patches which are seen on the tongue and on the buccal mucosa. So that is oral thrush, where it involves the oral cavity. And esophageal candidal lesions are most commonly seen in AIDS patients. Now, manifestations involving the internal organs are intestinal. So in intestinal candidiasis, there will be a history of prolonged oral antibiotic usage. So there will be a person who has been taking oral antibiotics since a very long time, and this patient might present with diarrhea which is not responding to antibiotics. that suggests intestinal candidiasis. The second lesion in internal organs is bronchopulmonary, which could be a complication of any existing pulmonary disease. Then you could have a UTI or a urinary tract infection, which is associated with prolonged catheter insertion. So there might be a patient in whom a catheter has been inserted and they will present with a Candida UTI. Other lesions will include septicemia, endocarditis or meningitis, and this is most commonly seen in patients with leukemia or any severe immunocompromised condition. So you will see in all of these conditions, whether it was mucosal conditions or conditions involving the internal organs, there is always a history of some sort of a immunocompromise. There might be oral antibiotic usage or any existing pulmonary disease or leukemia or insertion of a catheter, or in case of mucosal lesions it could be pregnancy or AIDS. So Candida mostly affects people with a pre-existing immunocompromised condition, and that is what is known as an opportunistic infection. For the diagnosis of this infection, we can do gram staining. In gram staining, what we see are gram positive budding yeast cells. So they are gram positive in nature. Next, we can use culture. So on the normal culture, which is on Sabouraud's dextrose agar, we see creamy and smooth colonies. That is what we see when we do a culture on Sabouraud's dextrose agar. Whereas in a special agar called col meal agar, we can see something called chlamydospores. So that is a characteristic of Candida albicans, chlamydospores, which grow on cornmeal agar. If we look at the specific medium, it is a chrome agar. Now this agar is specific for the Candida group of species, and on chrome agar we can see colored colonies which are observed on chrome agar. As we can see, chrome, which means color, so they will produce colored colonies on chrome agar. These are the culture methods. On Sabouraud's dextrose agar, creamy and smooth colonies. On col meal agar, you see chlamydospores, and the specific medium, which is chrome agars, you can see colored colonies. A third test is called a germ tube test. This germ tube test helps to differentiate Candida albicans and Candida dubliniensis from the other species of Candida. This is called germ tube test. In this test, what we do is we take the colonies, the Candida colonies, and we incubate it at 37 degrees Celsius in human serum. Okay, so at 37 degrees Celsius in human serum, we incubate these colonies and we check for the production of germ tubes. If germ tubes are present, which means if germ tubes are produced, we can confirm that the species are albicans or dubliniensis, because these are the only two species which show germ tube positivity, albicans and dubliniensis. And if the germ tube is negative, it means it is other species like Candida glabrata, Candida auris. The phenomenon of production of germ tubes by these two species is called Reynolds broad phenomenon. In the treatment part, if we have a mucocutaneous version of Candidiasis, we can give topical or oral azoles, which can be fluconazole or clotrimazole or ketoconazole. So azoles group of drugs are used in the treatment of mucocutaneous Candidiasis. Whereas in systemic Candidiasis, we can use amphotericin B, or azoles can also be used.